To treat primary hypertension, a patient is given a prescription for a calcium channel blocker. Which of these foods will the healthcare professional advise the patient to avoid while explaining the medication? A. Eggs. B. Milk. C. Bananas. D. Grapefruit. 50% protein binding indicates that a medication is A. 50% of the drug is available. B. 50% less protein should be eaten. C. 50% will pass through the intestines. D. 50% of the drug destroys protein. Holding a sterile gauze pad over the injection site while removing the needle serves to A. Seal off the track left by the needle. B. Increase the absorption of the medication. C. Prevent pathogens from entering through the puncture. D. Decrease the discomfort of the needle pulling on the skin. A 3-year-old patient with acute otitis media is given the medication amoxicillin suspension 200 mg PO every 8 hours by the pediatrician. The youngster is 38 pounds. For kids up to 40 kilograms, the suggested dose range is 20 to 40 mg kg day, divided into 8-hour intervals. What is the nurse's best course of action when following the 10 rights of medication administration? A. Contact the pediatrician to clarify the dose. B. Administer the medication as prescribed. C. Refuse to give because it is not the drug of choice. D. Withhold the dose because it is too low. The nurse checks with the patient to see if there are any drug sensitivities before giving penicillin intramuscularly to a patient with NKDA on his medical record. The customer replies, "I'm not certain. One time, when I was ill and received a shot, I might have developed a rash." Which course of action is best for the nurse? A. Ask the client for more details before giving the penicillin. B. Hold the penicillin and contact the prescribing provider. C. Administer the penicillin and observe for 60 minutes. D. Contact the hospital pharmacist for oral penicillin. Hepatitis is the patient's diagnosis upon admission to the medical facility. Which phase of pharmacokinetics is most affected by the patient's diagnosis when the healthcare professional is getting ready to administer intravenous medications? A. Distribution. B. Excretion. C. Metabolism. D. Absorption. A patient complains of having watery diarrhea for the last 3 days when they arrive at the emergency room. Blood pressure readings of 160, a pulse of 98, and dry mucous membranes are other assessment findings. Which of the following fluids would the healthcare provider expect to provide intravenous treatment with? A. Hypotonic crystalloid. B. Hypertonic crystalloid. C. Isotonic crystalloid. D. Colloid solution. A client intentionally overdosed on benzodiazepines, prompting the emergency department doctor to order flumazenol 200 micrograms for a push stat. Flumazenol is present as a 0.5 mg 5 ml solution in the stock vial. How many milliliters should the nurse prepare and give? Give a response with 1 decimal place. A. 0.5 milliliters. B. 2.0 milliliters. C. 2.5 milliliters. D. 4.0 milliliters. For a patient with severe heartburn, the healthcare professional recommends taking aluminum hydroxide suspension every 2 hours between meals and before bed. Which side effect should the nurse bring up when the patient returns for a follow-up appointment? A. Insomnia. B. Constipation. C. Palpitations. D. Dizziness. Which of the following is not required to be a part of the order when a practitioner prescribes an 4-infusion drug to be titrated? A. Initial or starting rate of the infusion. B. Frequency for increasing or decreasing the incremental dose. C. Ability of the nurse to determine the units of incremental rate. D. Objective clinical endpoint or patient response. The lab and blood bank need a sample of the patient's blood before the patient can receive a transfusion of whole blood. What tests will be conducted? A. Blood type and cross-match. B. Blood type and antigen screen. C. Complete blood count and differential. D. Blood culture and sensitivity analysis. Total parenteral nutrition and lipids should be administered to a patient with an acute aggravation of inflammatory bowel disease. Which of these treatments should be given top priority while treating this patient? A. Infuse the solution in a large peripheral vein. B. Monitor urine-specific gravity every shift. C. Monitor the patient's blood glucose per protocol. D. Change the administration set every 72 hours. The medical professional is ready to provide a corticosteroid to a patient who has been diagnosed with asthma. What justification exists for giving this medication to this patient? A. To prevent respiratory infections. B. To promote bronchodilation. C. To promote expectoration of mucus. D. To decrease airway swelling. The healthcare professional gives NPH insulin to a diabetic patient at 6 a.m. How soon might the patient exhibit hypoglycemic symptoms? A. 8 a.m. B. 7 a.m. C. 9 a.m. D. 10 a.m. The doctor prescribes Zofran 8 mg PO once daily. A 100 ml bottle with the label 4 mg TSP is sent by the pharmacy. How many milliliters should each dose contain? A. 2 milliliters. B. 10 milliliters. C. 5 milliliters. D. 8 milliliters. A patient is admitted to the medical unit for alcohol withdrawal and detoxification who has a history of serious alcohol misuse. The individual acknowledges consuming alcohol 2 hours prior to admission. Which drug from the list below will the healthcare professional recommend for this patient? A. Diazepam. B. Haloperidol. C. Naloxone hydrochloride. D. Disulfiram. Preeclampsia has been identified in one of the clients. The doctor prescribes magnesium sulfate. Preeclampsia is treated with magnesium sulfate for A. Sedation. B. Prevention of uterine contractions. C. Fetal lung protection. D. Prevention of seizures. What is the best way to spot breast cancer tumors in the early stages? A. Ultrasounds every 3 years. B. Mammograms every 3 years. C. Monthly breast self-examination. D. Yearly checkups performed by physician. An expectant woman in her 38s meets her nurse practitioner for her routine prenatal appointment. She is 30 weeks pregnant. Which condition connected to her age should the nurse be on the lookout for? A. Pregnancy-induced hypertension. B. Intrauterine growth retardation. C. Iron deficiency anemia. D. Sexually transmitted disease. The following are the main goals of a newborn's initial APGAR score. A. Evaluate the infant's vital functions. B. Determine gross abnormal motor function. C. Determine the extent of congenital malformations. D. Obtain a baseline for comparison with the infant's future adaptation to the environment. Registered nurses are a vital part of the healthcare field. They provide patient care, help patients with their daily health routines, and offer advice and emotional support to patients and their families. Depending on their specific areas of expertise, registered nurses may also perform administrative duties and get involved in policy and research. These responsibilities require excellent communication, advanced training, and emotional intelligence.